Hey, brother.
Morning, sir.
Good morning, man.
How are you, bro? How is it going?
Doing pretty good. Want to say aloha to everyone. Welcome. Welcome to Facebook Live with Mel and Charlie. Today is Thursday, the 4th of January. I'm sorry, February. Getting February. And we'd like to welcome you all here. Again, we'd like to say thank you.
February.
Thank you for joining us last night. Had a good response, good comments. Thank you again. To the management of HHSC Kauai region for stepping in. But
Yeah,
we have a really good show tonight, Mel.
yes, we do. Yes, we do. Thank you guys all for joining us again. Oh my God, see, I tell you, bro, it's been a rough day.
Yeah.
It's just been one of those days, where you're just forgetting everything. But anyway, here, let me get this thing set up here. But anyway, yeah, we all
Oh,
know.
you're frozen again. Oh, I got worried there. You got frozen just for a little while. Says my internet cable is unstable. Try look at your bars over there. And I know, okay, try breathe because pretty soon. What is your internet cable showing on my end?
Um, I'm not showing anything actually. No, I mean, I'm just showing that the signal is strong. You're looking good though.
Thank you, brother.
You're
Yeah,
looking good.
so
But anyway, COVID has affected a lot of people, and one of the demographics in Hawaii, and not just in Hawaii, actually, throughout the country, is the Pacific Islander community. And we've seen them on TV. Whenever a cluster breaks out in the Pacific Islander community, they have no hesitation to let the world know. But it is a fact that they are one of the segments of the community that is the hardest hit. And a lot of it has to do with the lifestyle, multi-generational households. I mean, I lived in multi-generational households pretty much all my childhood life. We had grandma, grandpa, mommy, daddy. So it's not uncommon in Hawaii. You see more and more of it, especially with the housing shortages around. But the hardest hit demographic is apparently not getting the attention for whatever reason, communication, technology. So anyway, our guest tonight is Josie Howard, and she's the program manager or program director at We Are Oceania. We Are Oceania. You've seen them
Oceania.
on you've seen him on TV numerous times. She's been on many panels. She speaks all over the place as a representative of the community of Pacific Islanders. So she's going to be on our show tonight to share some of the challenges that they're experiencing, more so on Oahu, but those challenges occur on every island. So I'm very interested. I haven't spoken to her yet, as you know, that's pretty normal with our show. So I'm excited. I have seen her on TV quite a bit, as Charlie, as you have, and many of our viewers have. We've also sent out invites to our Pacific Islander community leaders here on Kauai. And so hopefully we get a good broad base. And again, informing and educating is what we try to do. So we could talk about people that said this is what's happening, or we can talk to the people directly to tell us what's happening. So now would be a good time to hit that share button. Charlie, your handwriting is much nicer than mine. It really is. Mine suck. But the idea is to get you guys to push the share button. Share it, share it, share it. And we promise tonight is going to be interesting and exciting. She's a great emotional or passionate person that we're going to have a good time. But other than that, Charlie, how was your day today?
Well, I got to tell you, I was I was a slug, or a bug in a slug, or a slug in a bug, whatever you want to call it. I was just damn cold, let me tell you. Cold all day. Darn.
Whoa. I usually have my air conditioner running. I don't have it running. It is nice and nippy here up in the White House lots, and we are right on the bottom of the sleeping giant, so we get that draft that comes down, and it's so
Mm.
sweet. It's
You
so
know,
cool. I love it.
last time I was in your area, I was telling Steph, and I said, man, it reminds me, the greenery back there behind the sleeping giant, as you can pass through. It reminds me so much. Um, it reminds me so much of upcountry Maui in a way, going up towards Makawao. I miss that. So it's just really nice. There's a lot of areas that I haven't discovered fully since I moved to Kauai, but I definitely will. It's just, I'll be honest, I just am too afraid of getting lost, and I get so much pride. I don't like ask for help. I try to be like He-Man, and you know. So what I do is, like, last time I got lost, I just waited to watch the sun where it set, because I know I live on the west. So the sun was going down. I just went hit for the sun. But the sun was a little bit over Kalalau, and my car got stuck right by Hanakapi Ai. I got stuck around there.
Yeah, you're right, Charlie. There's so many places like that. I early in my seventh grade year, I lived in Kailua on the windward side, and I remember back when Kailua looked like this. It was a mountain, and if you go to the Pali side or it's so green, a lot of green, and that place has developed so much since I was there. But I loved Kailua. I loved Kaneohe, Aikahi, Kalaheo area. My auntie folks, that's where they lived. I spent a lot of time there. But here on Kauai, like the North Shore, if you go take those roads that you normally would not take, and yeah, you get lost, but some
But
of
over
those
here,
roads you cannot turn around, so you got to reverse all the way out. But the beauty that you see, Blue Mahai and all of those areas up in the mountains. Oh man, we're so blessed to live here. I gotta tell you, man, we are just blessed to live on this island or in this state for that matter.
well, every time I pass Coco Palms, I knew when it was in its heyday, because I still can remember it. And it's just so sad you see it now, ever since the storm.
Yeah.
And I don't know, for some reason, I start to sing in the cars I pass, and I start singing like, dreams come true in blue Hawaii. I don't know why, but some
Yeah.
people say I definitely don't sound like Elvis.
You look like him though. You if you grew your sideburns down, bro, splitting image. Splitting
Brother,
image.
you asking one Chinaman for grows down? I can't even get them to grow over here. What do you mean down over there?
Real quick story before Josie comes on. I know you know this, Charlie, but my mom worked at the Cocoa Palms for a long time, and we grew up at the Cocoa Palms. We spent a lot of time. My brothers and my sister, we spent a lot of time at Cocoa Palms, especially on the weekends, at the lagoon, at the zoo. We had we knew all of the animals by name. They all knew us, and it was
Yeah.
a fun time. And here's a little trivia.
Mhm.
My mom, if you remember the movie Blue Hawaii,
Yes, I do.
you remember when his girlfriend or whatever she was drove the Jeep into the lagoon?
Yes.
That was my mom driving the Jeep.
Oh.
That was my mom. They could not they back then they I guess they couldn't afford stunt doubles. They had those actresses doubles but
Mhm.
they needed somebody, and my mom volunteered and took them in a drink.
Well,
But she
brother.
got to meet Elvis. In fact, there's pictures of Elvis holding my oldest brother, who was an infant at the time,
Hmm.
Gerald. You know Gerald.
Yep.
There's a picture with my mom, my dad, and Elvis is holding my brother. That's pretty cool.
Well, just like my great great grandfather, you'd never think that they would get to star in roles, but he did, and I still have that picture board. He starred in this movie. It was filmed in New York. They show him climbing up the Empire State Building until the plane shot him down. His last name was Kong. First name was King. Yeah, that's my great.
Oh my gosh. Josie, hurry up, Josie. You're killing me. Hurry up, Josie.
But what I do want to say is this, for Coco Palms, Gus Landers, okay, the
Mhm.
original owners, you just don't have hoteliers like them around. Everything is corporate, owned by hedge funds or whatever. And you kind of miss that, when you have a hotel chain, even like the seaside hotels, right?
Mhm.
Local family owned. You have that love and aloha that's expressed to all the employees because they're the ones that convey the aloha spirit to all who visit. And once it goes into a corporate market, I'm sure there's employees that really go out of their way to express the aloha, but everything starts from the owners of the property. And the question is, with all these big hotels like the Sheratons and the Marriotts, I'm pretty sure some of the hotel workers have seen the owners, but how many of you can say you actually saw an owner?
Yeah.
It's not like the old days. The old days, the owners would come in, have the grand dining room, right? The Coco Palms.
Yep.
Gus Lander would be there having dinner with the wife, and everybody who knew him were happy that hey, the owner's here, and they just enjoyed themselves. So
Yeah, they actually had built quite a bit of relationships, personal relationships with their guests. They were
mhm,
amazing. That back in the day, and I think it's in many cases still happens, but not as often as the old days where um, these guests would come back every year, and
yeah,
now you go where you got so many new hotels.
mhm,
um, People experiment with different properties, but back in the day, they were loyal. They were loyal, but because they were treated like that, they were treated
mhm.
by the owners and the staff. Everyone knew everyone personally,
Yes,
and
that's how it was. But then you kind of wonder now if you could just think back then if there was any hotelier that we know of that's still alive and had any of the hotels, what would they do during this period of COVID? That'd be a real interesting question.
yeah,
I think they would handle things a little differently because they're more, embracing. They'll try. I don't know. It just will be an interesting thing to kind of wonder what they would do. What they would
yeah. I mean, it's so hard right now.
do. Yeah.
how do you keep the operation going? With the economy the way it is, and we were talking, Charlie, and you and I spoke of that one property on Kauai. I'm not going to mention any names, but the family on Maui is keeping these hotels afloat with personal money now
Yeah.
to keep, at least keep as many of their employees as they can. But how long can they do that? How long can they do that? So
Right.
yeah, it's some very challenging times. I just saw on the news tonight that the unemployment office now. I don't know if you saw this, but the people are getting 1099s now. The people that receive payments are getting 1099s. If they don't pay, if they were overpaid, I guess they're contesting. The people that got the checks are contesting, said that that's not accurate. But it was interesting because the DLIR lady, the director, came up and she said the majority of those 1099s are correct, are accurate. Like the majority, okay, a majority of them are accurate. Well, that means some of them are not, and you sent it out and causing a lot of stress for a lot of people. They got to
Mhm.
fix that system. They got to fix that system. I'm gonna go ahead and email my friend Josie because
Well, someone just posted, and you're right. Uncle Richard Kimmy was the owners of all the seaside hotels.
oh, there she is. There she
Maui
is.
Seaside.
Woo!
Yeah.
Yeah, the Kimmies. They were the hoteliers too. That's right.
Yeah. So,
Right.
it's a local chain. And so,
And
hello,
there she
there she is.
is.
Aloha, I am so sorry for being late.
You had me
Oh,
a little worried, just a little, but
Last minute, my sister asked for help. She had to move out. And so I was like rushing, getting home just so I can get on Zoom. So sorry.
no,
no.
please do
Are,
not
are you?
apologize. We're having some fun
Yeah.
talking about the old days and the hotels, and But I'm honored. We have a celebrity in the house, Charlie. We have a legitimate,
Yes,
genuine celebrity in the house tonight.
and she's coming to us all the way from the Grand Canyon, I see.
Okay, first of all, I'm not celebrity, and yes, I love the canyon. So I
Uh,
thought, it would be a treat to have that mighty, majestic background just
Well, you're
for
oh, good.
definitely
honoring
majestic.
Hawaii.
Well, I'm Mel, and the Hawaiian is Charlie.
Aloha Mel, aloha Charlie.
Hi.
And for our viewers, this is Auntie Josie. I just saw someone calling you Auntie Josie. So I'm going to call you Auntie Josie. You can call Uncle Charlie, and you can just call me Mel. Anyway, as you can see, we have a lot of fun on the show. But Josie is the program director for is it Oceania or Oceania?
Oceania.
Oceania.
Yes.
And so why don't we start there, Josie? Introduce yourself and your organization and what you folks are doing here for our Pacific Islander community.
Um, okay, so my name is Josie Howard. Um, I came to Hawaii as Josie Jose, and I've been in Hawaii for over 30 years now. And we are Oceania. It's a initiative to, as more of our people uh, arrived in Hawaii, and we saw the challenges, of our community members in navigating the new system. Um, it was a dream to kind of like replicate what our culture has, where we have a canoe house, and when visitors come to our islands, they come to the canoe house first, and we take it from there. They connect to the people on the island. We go over genealogies, clans, who belongs to what clan, and we were able to align them with the families. Um, so that was kind of like, that's the whole model, and that was the whole idea behind We Are Oceania, was a one-stop center where when Micronesians come to Hawaii, there's a place where they can go and get oriented. Um, and I know we're not perfect in um, helping them to learn how to navigate everything, but at least like one place where they know that if they have any question, they can go to. So that was the whole goal. Yeah. And our
Josie,
mission.
Can you help me out a little bit? Because I know a lot of us, obviously, I've never been to Micronesia or any of the islands, but maybe you can give us a real short overview of the similarities of
Oh,
your those islands and ours, and some of the differences. And
I
if you
can
could do that
definitely
for us.
do that. Definitely. So it wasn't long before I realized, when I first came to Hawaii, that there were so many similarities. One was environmentally, like when I went to Hilo, because I went to school there. I see breadfruit, I see um, coconut trees and food that we eat back home, and I also learned the names, and the names were so um, similar to our naming. For example, coconut tree, we say nu, and I learned here is new, or am I right? And also the canoe, we say wa, and here they say va, or is it vaka? And five, limo, it's lima. There's a lot of similarities, and face, eyes, we say maha, and I think Hawaiians say maka. Um, those were some of the similarities that I learned right away. And then I started to talk stories and establish friendship with the native Hawaiians that were going to UH Hilo. In fact, three of my best friends are from Kauai, and sharing their stories of how they had to learn their language in school again, and that when they were doing hula, that's how the language was preserved, but they had to hide it. They would do it in hiding places, because it was banned, and it was just, for me, I realized that also the experience in going through colonialism and in going through that experience of, that it was very similar to also our journey in time. And it was an awakening for me. I realized that the Native Hawaiians went before us, and we were right after, not, yeah. So yeah, I think there's a lot of similarities in culture, in values, family, ohana. When I learned the word ohana and learned the word aloha, you know, um, they're very similar to what we practice. It's just different naming. Aloha, in fact, in my language, is the name of the mid of the day, which is it's the most, uh, you know, you can get energy you can get out of the day. So there's so many similarities, and
Okay.
that really helped me connect. Yes.
Let me ask you something, Josie. First of all, with your culture, and this is and we'll talk about it more as we talk about, with what's happening now with COVID and vaccines later on. But I just wanted to understand the culture. What brings someone from Micronesia to resettle in Hawaii? Is it because it's demanded, or is it because of, say, opportunity job-wise, or what really is it? Knowing that this may be a new venture with a lot of having to have an understanding of a lot of new things, and
Sure.
so and is it seen upon by your people differently here in Hawaii as if they were to, say, go to California or Seattle, someplace like that?
That's a really good question. And I cannot answer that for everyone, but I know for sure for myself and many friends that I have talked stories with. I think, first of all, for me, it was education. There's no second year, there's no 4-year college and or master's program in Micronesia. And if you want to further your education, you have to go either to Guam or to Hawaii or to the mainland. And the reason for Guam and Hawaii is because they're closer to home. Traveling or going off the island for us, it's something that it's really, I remember back then, just um, not having the dream to go to college because I knew that as a woman, I could not go off the island. And, presented with the opportunity and coming here, I never really thought about even the other stuff. All I thought about was I need to go and get an education, and so that I can come back and take care of my people, because there is a need for someone to be a doctor because everyone was getting sick and we just didn't know how to, our local medicines were not working anymore. um, Now, other people today, some people are coming here because their families are here, and they uh, they come so that they can join their families. And other people are also coming because there's work opportunities, definitely. And I think, and I have to say, and I have to apologize if it comes across like not in a kind of disrespectful or inconsiderate of us to do that, but I felt that when I came to Hawaii, I have to admit that I never really knew that there was a host culture of Hawaii. All I knew was, Hawaii is Waikiki, the hula dance. And so it was when I went to Hilo and start, settling down, that I learned, oh my gosh, this is very similar to where I come from, and it's just that they're more developed. So I don't think a lot of us come here, kind of in a way that we just, tourist kind. It's really because there's a reason, and it has to be a reason that gets you to get off the island. um, um, and I must say that start um, as we start um, depending on cash economy,
Hmm.
we started like so when you ask, is it like, are you forced to come here? Nobody's forcing us, but globalization is forcing us, and that's what I believe. Because like for me, now I look back and I'm like, you know what, I could have just stay home and eat the taro and eat the fish. Is more healthier than me, not having an option sometimes and just go McDonald's. I learned when I came here, and I learned as I look around me, and as I start, getting more involved in the community and see the inequity and those kind of things. And I don't see any difference, when you are in low income, everyone is the same, no matter what ethnicity they come from. That's what I started learning, and I started to, realize. Yeah,
Okay.
I hope I
Well,
answered the
No,
no,
question.
no,
that
no, 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 that's perfect.
your,
I,
your
I
last
wanted,
statement.
and I apologize, I asked that question because, we all want to see, it doesn't matter what type of race, we all want to see people succeed.
Yes,
So sometimes it's getting to understand, people that come over,
yes,
we try to understand first, they're coming over because of, and
yeah,
sometimes, we've heard a lot of misinformation, like, people coming from South America, drug dealers, this and that. And we know that's not true. We know
yeah,
that's not true.
yeah,
So we try to understand, especially in Hawaii, because, it is a melting pot,
yes.
but I'm sorry. Uh, but because the islands are relatively small, well, population base, it's probably bigger than Micronesia, I
Mhm.
presume.
Yes,
But at the same token, there's only so much to go around, and we want to make sure that, hey, if we're heading in a right direction, I'm pretty sure that we can always help each other out, and I think that's the reason why I asked that question.
yes, definitely. Yeah,
Okay.
I loved your last statement when you said, when you low income, when you're poor, it really doesn't matter what race or what. I love that. That was well put and perfect timing, I guess. Because
Mhm.
that's so true. That's so true. And in Hawaii, as Charlie said, we're the melting pot. But with that, in the old days, in the
hmm,
plantation days, it was
hmm,
really weird because not weird, it was actually much better, where every culture was identified, it was clear, but everyone was able to commingle, coexist, and share with each other. That's just how it was. And I can remember that, even I'm not that old, but that's just how recent it was.
hmm.
And today it's a little different, right? Now we see, the just different ideas have come to Hawaii. We're a different society now, where what's mine is mine, what's yours is yours, and don't touch mine, I'm not going to touch yours. It was never that way in the old days. And and that's the sad part about what is happening here. But as it relates to we are Oceania, and your efforts to try to reconnect or connect the communities and make sure that they're getting the right information and getting good information and making sure that they're getting the services,
Hmm.
and getting basically just being able to coexist. Are you finding challenges with that? And not with COVID yet, but just in general.
I think the challenge that I find in working with WOW, and I didn't understand it then, but the more experience I got and the more I learned in school, I also got to learn that a lot of the challenge we face is with inaccessibility to certain things that will make life a lot better or a lot easier. And a good example is, with the COVID, there are services, but it's not, we say there's vaccine, but to access the vaccine, there's a process. And if you don't have internet, and if you don't have, if you don't know how to navigate, surf the net, and navigate, use the computer, there's no way you're going to be able to get vaccinated. So that's, I think, to me, that's it's the most, because it's about equity. And if we don't have the access to make ourselves, like to lift ourselves up or to uplift, our people who are poor, then it's going to be difficult for us to access that. And so that's the same thing with all across. And I see that with housing, the lack of affordable housing, or somebody said that term is not correct, but the lack of houses that it's affordable for our people, right? They can afford it with the minimum wage. When I used to work at Goodwill, I learned that there's no way our people are going to make it. If you're going to do the entry level job, you're gonna remain homeless, and you're gonna remain, in a studio. You're not gonna have the choices. Otherwise, unless you work on your children to go school, and they can gain the education and get a better job for your family. Um, so those are the kind of things that I learned, and that's what we try to do at WOW. Our mission statement is to empower the Micronesian community to navigate success. I think our culture it's such an empowering culture. You know, uh, uh, when people come to me to look for a job and they say, "Oh, I never worked before," I said, "Do you fish?" "Oh yeah, I can name all the different fish, and I know all the different ways to fish." Say, "Well, maybe put down fisherman. You know how to fish, so you can go apply a job over there." Or have you ever cared for kupunas or for children? Of course, because that's part of our culture. It's just how you see it, right? And how you and our culture has always been empowering. So I tried to use that, model to model our culture, because that way then our people don't feel so deficit, like, as if they're incapable and not able to do things. Yeah.
Let me ask you, what is the population statewide, the numbers of Pacific Islanders that are here now? Would you happen to know that number?
I can give you an estimate of Micronesians in Hawaii,
Yeah.
and I believe it's between 20 to 25,000.
Okay.
We haven't really have a good census data,
Yeah.
but we believe it's between those numbers. Yes.
The reason why I ask is, it's in some ways it's kind of heartbreaking because I know what you're saying, because most of the Micronesians that I've seen,
Mm-hmm.
they'll get jobs like at say McDonald's,
Mm-hmm.
someplace like that, and uh, I think to get ahead, you said it, they need to elevate. They need to
Yeah.
elevate. Maybe need to go back to school, and
Yeah.
if we got some idea of how many of them of your people are here, and then on Kauai, I think we do a pretty good job. We
Mm-hmm.
have the people here, especially with Salvation Army, that they reach out to the Micronesian community. But I think in a way that there's more that needs to be done.
Yeah.
And so getting an understanding of how many of the Micronesians are here and where they at, that maybe they need more community help groups to go in there and really sit down with them and tell them what's available. So when they come over from Micronesia, do they go through a whole cadre of opportunities before they leave the island to show them that, when you get to Hawaii,
Yes.
depending what island you go to, if you have family, okay, that's a start too. If you don't have family, this is what you're probably going to have to do. You're going to have to look for a job. You're going to have to apply for this, that, and whatever. Uh, Give them the ideas of the islands, like, because, telling them about Kauai, you can
Mhm.
only go probably 3/4 around the island. You can't go all the way around the island. But yet, if you go to Oahu, for example, you can go all the way around. Are
Yeah.
those kind of informations shared with them before they even get on the plane to come here?
I think it would be unfair for me to say yes or no, because I haven't been in Micronesia for a long time, but I know for my time, no. I mean, I didn't even know that I had to catch two planes to get to Hilo. I thought Hilo was on Oahu. So when I looked at my plane ticket and there was another trip in the evening, and I'm like, wait, where am I going? And I heard about Maui and I heard about Kauai, but I didn't realize that they were neighboring islands. So to answer your question, I know there were some attempts for orientation process, but I don't think it to that specificity, like not that specific. Um, and another reason too is, people, we don't have a screening before people leave the island. People are leaving if they as they are going to school, as they're going to their families. And the other way too that I learned, and there's actually like a lot of heavy recruitment, is people leaving to go to work with companies that recruit them all the way back home. And actually there's those in Kauai, as I learned. And I met some of them with the coffee at the coffee, Kauai
Right. Oh,
coffee
right.
plantation. Yes, and it seems like they have a really good process. They work with the government, and those they I think they do a lot better because they go through a process. But the ones that are recruited by cleaning company and other, I think farms, taro farms or rice farm, is all I heard is that they're not working with the government, so that's a little bit different. And I know that most of those people they go to Kauai.
Mhm.
Yeah.
There's a comment from Rosie Marsh, and she said, "We hire every day. We train our employees. Attention plus care. We have a uh, lot. I guess they're hiring people every day. So she's asking me to tell you. So Rosie, you can reach out to Josie at We Are Oceania. You can they're on the web. Just go. Uh, any kind of assistance we can provide. Obviously, we would appreciate. Thanks for bringing that up. Appreciate that.
Thank you.
We saw a lot of stories since the pandemic,
Hmm.
and even when we had experts from out of the state or even out of the country come on our show and talk about the demographics of patients that are contracting COVID. The Pacific Islanders was one of the higher demographics. It was one of the higher, uh, ethnicities, I guess, that was getting the disease. And we talked before you came on. We talked about um, the multi-generational. Uh, that's how a lot of people live. It's not just Micronesians. I mean, my God, we got a lot of local people. I can tell you, there's a lot of Portuguese that have multi-generational households right now because of the housing crisis. And I know you said we're not supposed to say affordable housing. It's not, but we need affordable housing. That's what we need. It needs to be affordable. Period. But with that, you would expect more attention
Hmm.
by the government to provide outreach to these groups, whether it's Micronesians or any group. And yet that doesn't seem like it's happening, or I don't see it anyway. As we try to follow this as thoroughly as we can, what's it like on the ground, especially there on Oahu?
Um, in the beginning of the COVID back in March, I know we didn't. I think was it early March that we started seeing it in Hawaii, right? And we closed down. Um, I knew that once it hits our community, it was going to be devastating because of our history, of our the health disparities in our community. So it was it was not until I would say July and August, because we had reach out, like I start thinking and with other community leaders that I think we need to start being more proactive and reaching out to the departments, because we start seeing people isolating at home or running around asking where to go get the test when a family member is being tested positive from work or um, so I think that whole effort of trying to reach out and kind of helping organize the whole collaborative effort. So it took the community to kind of mobilize this whole uh, community effort to take care and to save our community. And so we reach out to Department of Health, start working with them, and we also formed the 3R team, which is Native Hawaiian Pacific Islanders, and started to create different committees that were focusing on certain aspect like communication, policies, and at the same time, it was a lot of things going on, like building pipelines of communication within the community so that when we learn information from the department, we can get that information down to the grassroots level, work with national groups so that we can get the data correct. It was just a lot of things. And um, I have to say that with a lot of effort, um, right now at this point, we have a much easier way to do things now because we're more connected with the department now. Uh, they do more outreach. They hire our Pacific Islanders for the contract tracing team that goes out into the homes. We have, uh, members of the organization coming out to our meetings, regular meetings, and coming with us when we go out and outreach into the community. We also partner up with um, the hotels, the isolation team from DOH, with the CARES call line, um, where we help with language accessibility. When our people call, they can three ways to call so that we can help that individual who doesn't really, speak the language. I think having those partnership established made the accessibility a lot better. I know I talked about the barriers, the challenges, accessibility challenge, and it needed us to reach out and needed us to create these partnerships in order for it to work. So collaboration is really, really the key in us being able to at least, successfully took care of some, yeah.
I wanted to ask you a question. You spoke of Kauai and Kauai coffee. And
Yes.
today I got a message, and I believe, we were able to put the human resources person from Kauai Coffee in contact with a organization that works with the Micronesian community here on Kauai. And the
Oh.
reason why I say this is because, as you know, we're in the 1B class, getting ready to go into the one, not class, but 1B tier, getting ready to go to the 1C. And in the 1B tier, it also includes essential agriculture workers.
Mm-hmm.
But for some reason, the Micronesian community that works at Kauai Coffee, either, and that's what I wanted to ask you, if you kind of would know, for some reason, either they were told or they just didn't want to take the vaccination shots, even though it was on company time. The company would take them to the vaccination location. Is there something culturally that would kind of stop them? I mean, do they listen to one person and then say if the person gives them the green light, then they all kind of migrate and said, okay, we got the green light, now we take the vaccine? Or is it just culturally they shy away from that?
No.
What can you say to that?
I think part of your question and part of your suspicion is correct. Like culturally, if an elder, like let's say in that group, they have a leader,
Mhm.
um, uh, you know, most likely the leader make the decision and they will follow. However, the decision is based on, whatever information they receive or we receive. Um, if they're not comfortable with that information, if they're not sure because either they don't understand, um, I think that that's when they can make that kind of decision. Also, um, yeah. And the other part too is there's a lot of myths going around and there's a lot of things on social media about, vaccine killing people. They're already claiming that the vaccine already killed people. And like we have to really work hard with our families to tell them, don't listen to those things and don't throw away those things. Don't post them on your, and listen to the doctors and get the right message. So that's one thing that we really try to work hard on, getting the information, the right factual information to give to our community, because uh, they will, whatever information they get, that's what they will base their decision on. And if that information is telling them this is not safe, definitely they're not going to get it. If the information is telling them, this is safe, I think they will do it. Yeah.
Now, where you get involved, do you tell the Micronesian community that it's okay to talk to law enforcement? Because I see a lot of times, I handle security contracts, many of them here on Kauai. And I know sometimes that when we have dialogues, they are very, very private. I can be just asking them a simple question and everything is, I don't know, I don't know. And yet I know they know, but for some reason, they just don't want to engage with any kind of law enforcement figure. Is that something culturally, or is it because an experience that they have run across? I don't know, but I would kind of like to know.
Okay, so I laugh because where I come from, there's no police officer. Okay.
Okay.
So There's no security too. And I know there are parts of Micronesia that there's no police officer. We still live off the culture. So, we have the Ohanas, we live within the culture. So it's the culture takes care of us, uh, just avoiding any problem that will cause ill feeling, or always value harmony, right? So and I think also with our experience, we have the highest number of arrests, with along with Native Hawaiians and other Pacific Islanders. If you look at the record, we have the highest number, and I think a lot of our people are very fearful of that. And for especially for COVA citizens, Micronesians, we get deported if you commit any felony. Now, when I talk about understanding what is
Mm.
felony, understanding what is this demeanor, all of those things, all of those terms, legal terms, medical terms, it's really important, because when you don't understand, then fear comes out of not knowing, not really knowing. So I think that's also part of it. But the other part of it too is, I'm sorry to say, but I think police officer or any authority figure, they just come across like, not only Micronesians scared of them, like other other people also scared of police officers, just because, of what they see in the media or what they have experienced, and so they're just like normally scared. And then on top of that, we're very private people, so if you're asking for uh, information, we're probably just, but once they get to know you as a person, not a police officer, you can have a conversation, and they probably will be the best friend you'll
I agree.
ever find. Yeah.
I agree, because this one Micronesian I know, you're right. Once you get to know me, even though it took 7 years, but once you got to know me, he talked to me a lot now. Yeah, okay.
Yeah.
Yeah.
Yeah. Yeah.
Yeah, I can. We before COVID, I was coaching Pop Warner football, and in our team we had quite a few Micronesian kids playing, and they're very good athletes. But the parents were so cooperative. It was like we like a new family, and till today we're very good friends. It's just amazing, really. I mean, the culture is so similar to ours that it was, you know, and you got to think about it too. A police officer that look like Charlie comes up and talk to you,
I know.
versus when police officer like me come up talk to you. I skate come on this show every night, and he's Waimea, and I'm in Wailua. We far away, but I still skate.
Yeah.
So when he look like that, to look at the way he looking, it's scary.
But you see, with Mel, when he talk, you already know he Portuguese. So you're talking about Portuguese. It's different.
Oh boy. Hey, Josie, I wanted to say that you became known to the world after the outbreak on Oahu, when everyone was concerned about the Micronesian community, the Pacific Islander community. Everybody was blowing that thing way out. Um, but you stepped forward. That's how, I think, for me anyway, that's how I remember getting to know who you were, because finally we had found an organization or someone that was willing to be the in-between and start to reconnect or connect, really, the pipeline, as you said. And that's where you became world renowned. That's why I say you're a celebrity now. And it really wasn't anyone else. It wasn't the government reaching out. It was the community stepping up and doing what they felt needed to be done to improve the communication between the communities and the government. So thank you for that, and you deserve a lot of credit for that. But
Thank you.
how is it now with testing? Let's just say before we get into the vaccine portion, the testing. Is the community getting tested? Is there opportunities for testing on Oahu for Micronesian families to get tested, or is it just what we see on TV? Every so often they'll pop up a mass testing, and you find your own way. And is there anything being done to reach out to the Micronesian or Pacific Islander community for testing?
I don't think we have the same issue as we have before, like let's say in September and October. And like I said, part of that is with the organizing of our PI community, the 3R team and the PI subcommittee, going out there and doing all this mass outreach. I also think that it has to do with now we're more organized. There's now people are also aware where they go, where do they go. So it's we don't find a lot of people calling, asking
Mm.
for where to get testing anymore. Yeah, and having family member learn about that, they start teaching each other. So yeah, so that I think that's already it's not as problematic as before. So I would like to believe that we have solved that issue.
Go.
Yeah.
Awesome. Awesome.
So to clarify, just so, because I heard a term, acronym used, PI. We're not talking about Filipinos. That's public information, right? Is that what you're?
No, Pacific Islanders. Pacific Islanders.
Okay.
Yeah.
I was
Yeah.
wrong too, but
Sorry.
hey, okay.
Sorry.
You see,
Yeah.
Josie,
And
you see what I mean? Now you understand what I'm talking about?
no, I'm having such a great time on this show. I thought I would
No,
be
because
like
when you say
perfect.
PI, I go, oh, you get Filipinos working with you. Oh, good, good.
Yeah, you see on this show, Josie, there's absolutely no holds barred. There's no restrictions. You can swear, you can, and it's live, so we don't edit it. It is what it is. So
Yeah.
sometimes Charlie get out of control. I gotta kind of pull the reins a little bit.
I must say that we don't just help Micronesians. With our food drives, we have actually, because we're one thing I need to acknowledge is we are Oceania to start us up, and even until now, we did not have the means to start getting grants and do the services. So we are sponsored by Partners in Development Foundation, which is a organization that serves Native Hawaiians, and they're very well known for their Tutu and Me program, and they
Hmm.
do
Oh,
have
yeah.
programs in Kauai. Yeah. So
Mhm.
so with that, and without them, we wouldn't have gotten the CARES funding to be able to really launch the initiative that we did with our helpline, with our community resource where they go out and chop off food and mask and all that kind of stuff. Um, Without that partnership, I don't think we would have made it. So I'm very appreciative of Partners in Development Foundation. And so our service, we don't just serve Micronesian, we serve everyone. With the enrollment into Obamacare, we serve all the immigrant population. So uh, uh, and I'm really proud of that, because I think that's part of being part of this community culturally. You come to be part of the community, and you become productive member of the community. So that's our whole hope, that eventually our whole Micronesian community will be integrated and feel as they're part of the community. I really believe that when you feel that you are empowered, therefore you become an asset, and your strength comes out. When you're kind of scared and always worried, your best doesn't come out, the worst come out, right? Because you're always in fear and in hiding. But when you're happy and you're embraced, oh, the best comes out. And so that's my hope. That's Yeah.
Wow. You should run for president.
Oh. No, I don't think I'm a politician. Yeah.
Now,
Yeah,
when they do come over, is any of them given, like, you have such a great organization that can be, I don't know if you're on each island, but I would say that if, like, say, if I came from Micronesia and I didn't know where to start, if somebody would give me a number that I can just keep with me in case I run into a little problem or I need help, that there's
Mhm.
somebody that can speak the language that I can converse with and then start. Do you have anything like that right now on all the islands?
No, but our helpline, it allows for that. so if people call our helpline, we have people from the different languages. So right now we have Chugis, we have Marshallese, Panabe, and Kosraeans. During the COVID, we even have Samoan. We lost, when that grant ran out, now we downsized. We were able to keep at least those four major languages, which I believe there's, Kosraeans, Panabeans, Chugis, and Marshallese in Kauai. I also know that I think the biggest population in Kauai is the Marshallese population. Um, so and they reach out to us. In fact, I think I'm really happy that I'm connected with you too, because then for WOW to be connected to resources in Kauai, or the system in Kauai, we can also help them. And they do have church groups, so that's whom we work with when we come out to outreach for the Obama healthcare. We would meet with the church leaders, and also work, um, oh, there it is. And also work closely with Department of Health over there, the WIC program. Yeah. Mhm. So this, oh, you're on our
Yeah, I
website.
went to the websites. It's for those of you that are interested.
Yes,
weareoceania.org. I just pulled it up just so you can take a look. Chukis, Marshallese,
Shrines, Panapin.
Kashtayan, and what's that other
Mel,
one?
Mel,
Panpayan.
Ponapin, Ponpe, yeah.
Mel, you know why I'm laughing right now.
Have no idea, Charlie.
You remember when it was We Are Kupuna? I saw
Yeah,
the website We Are Oceania, right?
yeah.
If I was to explain it again, I would have told them where Oceania.
Yeah, yeah, yeah.
I just wanted to make sure I don't screw that up. So that's why I was laughing.
Well, good. You really go check out their website. A lot of information on the website.
Yes, very much, very much.
Many resources. We'll post it up on the link on the comments so you guys can get it. Now, as we talking about the vaccines and communications issues and so forth, how are the community, and I'll just say Pacific Islander community, how is the Pacific Islander community getting connected with the government as far as getting vaccines? Because like you said, I know, I enrolled my mother-in-law. She's 82 years old. She does not have a computer.
Mhm.
And if not for myself or my wife, she would not, number one, she wouldn't even know.
Mhm.
And she's not Micronesian, she's not Marshallese, she's Japanese.
Mhm.
And how are we reaching those communities, especially on Oahu, to those communities that are not computer literate, don't have internet, like you mentioned earlier? What's being done to make sure we get into those neighborhoods or those communities to make sure that they're at least informed and educated about the benefits of the vaccine, and how can we get them signed up?
So I think it will only be fair if I say that, with my position, or with We Are Oceania's position in the community, um, I really had to step up again and find ways to bring vaccine to our people. So I reached out to Dr. Kindu at Kalipalama with some friends and with Project Vision, and we're having our first clinic, and they were trying to get maybe 10 people, and they're allowing for 65 and over, at our center. Uh, and we're partnering with the church that we're also operating out of, which is St. Elizabeth Episcopal Church. And we'll be there to help with the language, with filling out the paper. We're gonna, instead of going through the computer, print out the paper, and they'll register and fill it out when they come in. So it and I think part of that was the reluctantness. There was a claim that our community are not really wanting to get vaccinated. And I can honestly say that since I reached out 3 days ago, that list that we tried to get, the 10 people, it's already over 10 people heading 20 people, and that's only in 2 days, and we haven't even publicized it yet. So
Mm.
and I have to be careful as the middle person. I have to be careful because I don't want to let the community know they all come out because they want to get, but then the surface part is not ready,
Right.
right? The technical part is not ready. So um, with that partnership with Project Vision, I think we can be flexible, where we get the names down. As long as we start getting names of people and start scheduling people, then we can be able to start vaccinating. But I think that that claim that our community don't want to get vaccinated, I find that is not so true. There's a lot of our community members who want to be vaccinated. Yes, there are those who are scared, and I said it's because of the information they've been receiving so far. Um, I hear from church leaders, saying, we always get vaccine when we were young. It was part of our growing up. They understand what vaccine is. So, what's the difference? And I also hear church leaders saying, I don't have the information and I cannot explain it to my church members. I don't speak English. I really need you to give it to me in the language so that I can go back and my credibility, because you put it into the language. Because if I go back and I don't speak English, they're gonna ask me, "How you don't speak English?" Um, so, and I think that's a valid point. That was a really valid point too. So we try to help get those information to them, and yeah.
Well, I think what you can do is, you want to use me as an example. Just tell them before I got the vaccine, I was, I was just about 5 feet tall. And after I took my second vaccine, I'm about 6'1" now. So you can tell them that, no, no, don't go put on out rumors like that.
We gotta. That's weird because I was 6'4" before the vaccine, and I'm 5'8 3/4 now.
Because you got the wrong one. That's why you got the shrunken vaccine. No, but what's important, and I need to ask you this. It appears, you really put some hard effort into trying to get the word out about getting the vaccine.
Yes.
Now with these new variants that's already in the islands, which makes transmissibility much higher. That
Mhm.
means that if you just come in a simple contact, you're gonna get it. I mean, there's no way around it. Okay. Is something being now promoted by the organization to talk in the language about variants and getting the people to understand what is a variant, why it's so dangerous, why even and also because Mel and I we're still educating people
Mhm.
the fact that once you get vaccinated, that doesn't mean you still can walk around and that you cannot transmit the virus, because you still
Mhm.
can. Is there
Yes.
someone interpreting that to say, hey, once you get vaccinated, you'll be protected, but you can also be carrying the virus and shedding the virus to someone else?
Mhm.
Because right now the data is just, it doesn't have enough data to say otherwise. Are you
Yeah.
folks prepared to do that? Or are you doing that right now?
We are, in fact, part of, we took our vaccine and I completed my vaccine along with other coworkers. And we're planning on having like a panel
Yeah.
to share our experience with the vaccine. And we have talked about how we're going to share this. We do believe that being honest and being factual is, the key, and honoring that. Um, and then give our community the information, and they will choose for themselves. We also recognize that we cannot force people to do something that they don't wish to do, but we value that they need to get the information. I think that's really important, because I believe if they get the right info, most likely they're going to want to take the vaccine,
Mhm.
and for spreading the COVID. Um, so we do have. I don't know if you've seen our Facebook, but every week we created a show called Island Hopper Virtual Talk Stories. And if you've been to Micronesia, you'll understand what is Island Hopper. And that is the route of the plane that goes from Hawaii to the Marshall Islands. And so that's the lineup of our talk stories, and they're all in those languages. So Tuesdays Marshallese, Wednesdays Pohnpei, I mean, Koshai, Thursdays, Ponbe, and Fridays, Chukis. So that's where we bring out those information. We've been talking about the vaccine. We're going to share our experience. And we also talk about Medicaid. We just got the Medicaid restoration. So that was one thing that we've been talking about this week. Next week, we're probably going to put in, the education on these new variants and why it's important for us to be even more careful now. And part of that is to get the facts about that so that we can give out right information. So
So do you believe that because you opened up with that, some don't have access to the
mhm,
internet, so
mhm.
therefore I don't think they'll get access to Facebook. Do you believe that you can reach those people through other means?
So we do, yes, we do definitely. And the church leaders, meeting with the church leaders, we have talked about flyers. So with the Medicaid restoration, with the vaccine, we're creating flyers. We're going out to different outreach. We can disseminate those flyers. We also do a food drive, and we put those flyers into the food drives so that it goes out to the families. And with our service, people without phone, they come to our office every day. Every day we see like maybe about up to 40 people that comes for different kinds of things, and that's also where we give out the flyers. But the church is really the target. We're also working on trying to get the church connected to internet and devices like iPad, and even have account like Zoom account, and start training, because we don't know if COVID is going to ever go away. And with the way things are going, I think it's really hard to predict that. But I think it's also good to start getting adjusted to the way things are, and part of that is to you know learn those alternatives to be connected, um, and the church, to continue to worship remotely. Yeah.
Yeah. Church, a great place, great place to get the word out, credibility wise, accessibility wise, and it's a great resource. I was talking to at work today. I was talking to some of my coworkers and saying, "Hey, you guys got to watch tonight. We get Josie on tonight, man. The celebrities coming on." And but we were talking about this exact thing, and why is it so difficult for the counties or the state to get a van, one of those like a blood mobile. Remember the old days we had the blood mobile, we had a book mobile, we had all of these banks all had mobile bank mobiles.
Yeah. Yeah.
Why couldn't we get a vaccine mobile, right? And go into the communities? Why are we so hung up on this process that not everyone has access to? I spoke of my mother-in-law and many others that don't have access, but yet we the government keeps talking about how important it is for everybody to get vaccinated, but you got to make it down to Pier 2 or to the Blaisdell or to wherever. Many of our low income people here on Kauai don't have vehicles. The buses are stops are not like Honolulu.
Yes.
Honolulu, you got a bus stop pretty much everywhere, not here.
Yeah.
Some places are a mile, 2 miles away from a bus stop. But we're talking to them thinking, why wouldn't we just have a couple of hundred vaccines, and then
Mhm.
you just drive and you play the music like the ice cream truck, and everybody wants a vaccine? Come
Mhm.
out, fill out the paperwork, sign the waiver. That's the most important thing they're concerned about, making sure you don't sue them if something happens. Have them sign the paperwork, give them the shot and a date, and get it done. I just think that we overcomplicate things sometimes, and it just
Oh,
doesn't seem that difficult to go out to the areas that need the outreach, and to rely on people to come all the way into town or wherever you live. It's rough. You're not going to get everybody. At the same time, you get to inform and educate those people of why it's important to get the vaccine, that in fact the crap they're reading about on Facebook and
yes.
Twitter is not true.
Yes.
But if they're not on the internet and they're hearing it from the
Yes.
street, then how are you gonna get the right message across?
That's a really good point. And I smile because I was just thinking about that. If we ever get our hands on some kind of money, we buy us those fans, and we can mobilize ourselves in going to YNI, going to Wahiwa, which we did with the food drive. And that's how we were giving out the information. We had food drive in Wahiwa, we had food drive in YNI, we had food drive in Waipahu and Waimanalo. And so it really allowed us to, to get the information out into the community closer to the grassroots level. And so I just thought about that this morning because I seen that in Guam. We have a cousin organization that was born out of the same idea and same funding source. So our funding source, we were created by the Department of Interior. And this department oversees the relationship between United States and our countries. The money to fund my position and create WOW, it's really money that goes back home. But we are able to use it here because we impact back home. And whatever happened here, it's correlated to what's happening back home. But I saw that in Guam, when I went to visit our cousin organization, and we went around and to the places because Guam doesn't have bus system. And you're right, even though we have the bus system, but having like, those kind of events at Playstyle Arena, it's too big. You park somewhere so far and you walk, and the kupunas to come down.
Yeah.
I was really, like, that's just doesn't work, because it's hard for them to walk where they're gonna sit. It's just, I feel like it's, yeah. And you're right. If we think too hard, I think we think too much, too hard. And if we just think
They
flexible,
didn't have a problem setting
yeah,
up a testing site for visitors at the airport, because you
yeah.
know what I'm trying to say? We need to have that same priority, that same motivation, that same drive to go take care of our own. And that is, I think, where my frustration lies. And maybe, Charlie, maybe we got to contact Kai up at Congress and see.
No, I think what we should do first is, newly elected Councilwoman Esther Kiaina, she actually worked for the Department of Interior. So maybe you can tap into her, pick her brain and see what direction she can point you in. I think she'd be a good resource.
I like Kai because he goes up there and he talk Hawaiian and he give them that oni pa at Congress and they all listen because they're like, what the hell is he saying? They don't know.
Yeah.
But
yeah, you see, you just startle them with confusion. That's
yeah, it's like, God,
just
this
like
savage.
tonight,
What is he telling
I
us? I love it. I love it.
Josie, it sounds like we know what we're talking about, right? But we're just confusing everybody. No, I'm only teasing.
I just think that to me, when I don't know,
Mm.
maybe it's too simple, but if you sit down and you think about, wow, there's my buddy Jeff Thomas right there. Jeff, what's up, Jeff? I just saw him. He just post one comment. Man, I love that brother. He's one of my Micronesian contact. He's like a brother to me, man. I love that man and his family.
Yeah.
Anyway, something so simple.
Yep.
So you using an organization like yours, right, to go out and get all the registrations, because you gotta get these vials. We learned last night that the vaccines you gotta get the registrations before you can pull them from the inventory. So I understand that. So that's where you use the troops like you and your group and your team,
Mhm.
and then boom, Saturday you start up that wagon and you head west and you start whacking arms. It just makes so much sense. Makes so much sense.
Yeah.
Exactly. And I think I'm really hopeful
Good idea.
because COVID kind of opened that up. And, like there were things that we just didn't have any more choice. We got to do it because COVID was so powerful. And COVID kind of opened us up to be flexible. For me, it reminds me of the typhoons when it hits our islands and there's nothing. We have fallen breadfruits and fallen bananas, and we have to become very resourceful. What do we eat the next day? We go look for those fallen fruits and we eat. I mean, it's just, I think that's what really guided me is the cultural knowledge and cultural values that I brought with me, and also the value of people. Because when you start seeing people are not being taken care of,
Mhm.
then that's, to me, that was the my biggest motivation. When I start seeing people isolating at home and having 17, 15 people in a one bedroom home or two bedroom with one bathroom, I couldn't just sit back. There has to be something. There's no way the children and the kupunain at home would, get hurt from COVID. So that's what motivated us to do what we did.
Well, I hope for those that are listening tonight that they understand the whole purpose of having you come on, because it's been an eye-opening experience for me. I know we're going a little overtime right now, but I appreciate it. And the reason being, I really wanted to understand your culture, how the Micronesians think, because in order, see, we're all in this together.
Yes.
And the thing that we're trying to prevent is we're trying to prevent that spread. And if
Yes.
the Micronesian culture is going to get hit by it, they've got to be equipped with knowledge on how not to come in contact with this thing or try their best. And
Yes.
and that's what takes this behavioral modification. So I'm hoping tonight that if there's anyone out there that has been watching this show and has thought of an idea that might be thinking outside of the box, that might maybe reach more
Yeah.
and quicker, please contact Josie and share your idea, because the worst thing that can happen is the answer is no, but it doesn't hurt to try and just go for it, because I really think we're racing against time, really. You
Mhm.
know,
Yeah.
they say that, we got all the time in the world. Well, after 400,000 deaths, it doesn't seem that way to me. I mean, one death is one too many. And definitely we don't want anything to happen to any of our Pacific Islanders,
Yes.
especially our Micronesian.
Yes.
But the thing is, they have to understand why it's important
Mhm.
that we're taking this position, and why, and we don't want them to live in fear. I mean, Mel and I had this comment before, as a police officer, yeah, I'm 6'1", 280 pounds. You put on the badge, it's already intimidating. You wear a gun, it's already intimidating. So I always learn, you sit down and you look at eye to eye when you're talking to someone, so they don't feel intimidated. You don't stand over them looking down. You always look eye to eye. And I
Yes.
think the Micronesians need to know that, we're there to help, but they got to show some sign that they want to help too, and that, I think that's where you come in. That's where you
Yeah.
come.
Oh, thank you. Thank you. I'll take that with me. Thank you.
Appreciate you joining us tonight. I know we're in a little bit longer, but how's this? This is pretty cool, huh?
Hey.
Oop.
Wow.
My man Jeff, my man Jeff. Hey, thank you. Anything you wanna let out before we wrap up, Josie? I appreciate you being here tonight.
Well, I know I didn't have the chance to say it in the beginning, but I really appreciate this opportunity and allowing me to be on your show. I'm very honored. I feel very privileged. I know this is um, a space that I don't belong in, and it's just an honor for me to be here with you, celebrities. Now I should turn it around to you, but I also want to express my gratitude and sincere appreciation to Hawaii. It's been taking care of us, and I think we Micronesians have to do our part. And I really appreciate the fact that just being invited on this show, I feel the acceptance, and I think some of our young ones, and we didn't talk about this, but I think with their experience of discrimination in the community had really kind of add to some reluctantness in coming forward. But I know there's so much effort in coming together, and I feel like the COVID had allowed us to come together. And I just want to say thank you so much, and I will do my part in helping. I'm not my role in my community is servant, and I am the servant to my community and to the Hawaii community. So, anytime, yeah.
Thank you.
Awesome. Charles.
Well, as I said, first of all, I'd like to thank our guest tonight. Thank you so much, Josie, for coming on. We really appreciate your insight, and thank you for opening up, really opening up the gate and allowing that bridge to be made. I think I've learned more, and I hope the viewers have learned more out there. And to our viewers, again, we're all in this together. I know we talked about a lot of things. We talked about a culture that we know that they exist, but we really don't know what it's about. And I think tonight we've got a little glimpse of what it's about. And I think we're going to learn more as time goes on. But right now with COVID knocking on everyone's doors, we need to make sure whether you're Micronesian, Polynesian, you know, Chinese, Japanese, whatever race, right now we're in a fight for our lives right now. So everybody, as long as you live in Hawaii, we're all on the same team and we got to fight it together. And so I'm hoping and praying that, yes, you have some ideas, please share it with Josie and her team, because really it's all about getting the message out to a lot of the Micronesians who otherwise would just retreat. Because the best thing you can do, even if you get tapped by COVID, if questions is asked of you, that's the best thing you can do, just cooperate so we can stop it, not go into a retreat mode. So I think the more we get them to start having a little faith and trust in us, because if they came to Hawaii to make Hawaii their home, we're going to have to get along, and hopefully the message will get out.
Yes.
Mel?
Thanks, Charlie. Thank you, Josie. First of all, you do belong here. I mean, that's what this show is. It's to inform and educate. This is not a political show. This is not a medical show. This is a show that Charlie and I, what we try to do is inform and educate the public. We are all one Ohana here in this state. And you definitely belong on this show. Please. Oh my God, you broke my heart when you said that. But anyway, no, I'm serious, Josie. You belong. And please know that this is a venue for you and your organization, your group. If you want to, anytime it's an open invitation, you let me know, you right back on. And we'll probably be calling you to come back on again. But please know that if you ever want to, you need to get the word out and you need a venue, you want an opportunity, you can use this. We're not CNN and we're not NBC, all of that, but we do have a group of loyal viewers and we do have a pretty good reach. The other thing is, after 9/11, after the towers got blown up, people looked at Muslim, Middle Eastern people differently, whether they were doctors, lawyers, school teachers, nurses, because the society, the media made every single Middle Easterner be out to be the villain. With COVID, we have clusters all over the place. But for some reason, when it involves a Micronesian community, the media loves to come out and say Pacific Islanders, or even go as far as to say Micronesians.
Yep.
That is so unfair. So when that happens, right?
Yes.
Same thing, right? Now you're in the bus or you're heading down and you see a Micronesian or a Pacific Islander and you're like, oh my God, you probably get COVID. Because the media painted that picture.
Yes.
What the hell is the difference between a cluster of Japanese that went Vegas or a household of Pacific Islanders that happens to live together? So I get frustrated, Josie, and I wasn't going to go there, but I just something in your closing comments, I felt that I needed to say that because it's not fair. And we as a community, like Charlie just said, are in this together. I don't care if you white, black, yellow, green, brown, does not matter. We're gonna lose this fight if we don't stand and fight together. That's all I'm trying to say. So it doesn't matter. COVID ain't racist. They don't care.
Yes.
They don't care.
Yes.
COVID don't care. And neither should we. So we love you so much, Josie. We appreciate you, what you've done and what you continue to do. You're another angel. We got to call roll pretty soon of all the angels that's come on our show. You definitely are an angel. You definitely belong on this show. And we will continue to help as best we can to spread the word to our community here. And whatever we can do to help you, please, please, please let me know. This will be downloaded to a YouTube video. I'll send you the link. Please feel free to share it wherever you want to.
Thank you. Thank you so much. I feel so, I mean, aside from feeling belong, I feel so good. This is such a feel good show. When you say we all are in this together, that feeling of inclusiveness, I think that's what our community and not only our community, and I have to get used to that. Anyone who feels excluded, it's so important for them to feel that they are part of it, and you too make me feel like that tonight, and I really appreciate it. Thank you. I'm not going to call you uncle, I'm going to call you brothers. In my culture, that's the best thing I can do. So brother Charlie and brother Mel, yeah. So thank you.
Awesome.
Thank you so much. And again, please, the invitation is always open. Like we say, whenever we can get the word out, it only will help the situation.
Thank you.
That's all I can say. And we hope and pray that you have much more success in what you're trying to do. But I urge you to please go contact Esther when you have a chance, and just ask her about the Department of the Interior and what directions. And also, Rosie Marsh also says that they offer a huge benefit plan, retirement, the whole works, and they do all the training. And they're
Oh,
always looking for people. So she, I will send her number over to Mel, and he can email it to you. Give her a
sure.
call. If there's a group of Micronesians now that that's looking for work, she said they're willing to hire, they're willing to train. And
Okay,
so,
awesome.
that's the start. And it sounds like a good opportunity. Okay.
Thank you. Thank you.
Welcome. You're welcome.
Awesome. And I'm gonna close with my dad, who's in Seattle, and he watches us every night as long as his computer don't freeze up. But I'm gonna end with this comment. He just posted on the feed. All of us have the same color blood. That's what it's all about. My dad taught us that from baby time, that we're all the same, we're all equal. Color no means squat. We all get the same color blood. Thank you, Dad. I love you. I love all of you. Josie, thank you. You guys stay safe. God bless. Tomorrow night, Feel Good Friday. Three
Thank you.
businesses from Maui. Gonna have some fun. 7 o'clock. See you guys there. Aloha. God bless.
Aloha.
And
Aloha.
of course, how do you say what's aloha in Micronesian or Chukis or
Aroha. Aroha.
no? That's Japanese.
Um,
Or how do you how do I say goodbye? Have a good evening. We love you. All of that.
I just
Not too
Renalim.
long. One word. One word.
Venalim.
Yeah, Renalim.
Yeah.
The what?
Venalim.
Renalim.
Renalim or Shichu.
C2.
Shichu. Yeah.
That's like an explosive.
Like a hoi ho, like see you later.
The Chichu. Chichu.
Yeah, Shichu.
C2.
Yeah.
Yes.
Shih-Tzu. Okay, the little white hairy dog. Shih-Tzu. Okay.
Shichu.
You guys have a good night. God bless. We love you guys. Stay safe. Aloha.